okay, doc, I can just chew. And then, whenever I chew, it's killing me, then it's infection.
Okay.
The differences.
Okay.
So if I don't see any cavity from this shot, probably I wouldn't worry about it.
Okay.
But that cavity can be the major issue. So the cavity, we can get rid of it. But whenever some people who has pain with it, unfortunately, we cannot just clean the cavity. Because that means a lot of time your extended cavity already invaded to the nerve and then give you a signal that they touch each other. So if I just pretend I just remove all the cavity and then you're probably okay for like a couple of weeks and then come back in the same reason. And then after we did all that work, and then we probably have to do the root canal. So root canal is the way we can save the tooth. But we're dealing with the first molar, which is a wisdom tooth, second molar, first molar. We believe that's the most important tooth in your quadrant. And then in your age, absolutely we want to save it. If we hold that, I understand because of so many reasons people choose to remove the tooth. It's easy and quick, but the long term,
It's better.
yes. And then also you have any plan to do your teeth work, we definitely want to save it because what's the point?
Yeah.
If you will neglect your tooth and then not gonna do anything, then I'll be part of it. Just remove the tooth and then move to the next one. But what's next? Adventure?
Yeah, I don't want that. Yeah, my mom has
It
both.
it doesn't match to you.
Yeah.
So, and then if we want to save it, utilize this chance because we are working in the night and weekend. So if you doesn't conflict with your working schedule, we can do plans one at a time, get to the point to the area together. A long process. That's okay with us, one at a time. And make a priority and do it. But lower right side, it's a good thing we catch early stage. Even we do the root canal, if we catch it in early stage and you do not have a lot of cavity, we can save a lot of tooth structure. We can help you out. And then there's two things. Whenever we do the root canal, we basically access to the nerve, and then remove the nerve, and then put the artificial nerve. And then because we have to cut a lot of tooth structure, including your extended cavity, and then we have to build it up with a fresh material and then put a cap. Because again, you have to know all the options. Once we do the root canal, and then you do not want to do the crown on top of it, your investment is not really solid.
Yeah.
It's just shaking. If you will come back to do it in the short future, it's okay. Because once we build it up, we're using like a filling material, the same material. It's strong enough, but not for entire life. Because once you do the root canal, and then not putting a protection with the cap, what's going to happen, you will have a chance to fracture the tooth. Then after your investment for the root canal, you may need to remove the tooth in the future. So that's the right package to do the root canal, build up and crown together, but you can section that out, spread it out together, or you just do it all together and then forget about it. That's your option. And then Brandy will come in and explain your game with all the numbers. And that's totally up to you. But one thing, if you have infection, we can control the infection with the antibiotics and painkiller. Cavity is different stories. The cavity is cavity, and then we have to remove.
You said I don't have an infection, or do I have the little bit that you said on the sides?
So that infection is coming from different resources.
Okay, it's not from the...
That cavity. So infection can be from the calculus, which is like a collection of bacteria and they stick to your root, and then the gum cannot be healthy because of that, and then it make actions and problem. And then when I did a pick on you, and then you had some bleeding already. It's not good.
Yeah, I have bleeds in my brushing teeth.
No, because one thing you need to know, we have to remove calculus, then you will have a chance to maintain your oral health at home. But at least right now, without touching and then without cleaning all that and then give the best solution, you are basically cleaning the calculus you solve at home. Because there is a lot of stuff covering your tooth and then root surface, and then you were just brushing that on top of it. And then with professional equipment, we remove everything. You will give the chance to the gum that we cover back and then attach back to the roots, and then we call the healthy condition. And then you clean your tooth surfaces, not the calculus surfaces. Make sense?
Yeah.
So you probably need to come back for the deep scaling for sure. So lower right side, we definitely need the root canal and the crown. Okay?